this summer, I cared for a man called Jim. Jim was the nicest, most caring man you would ever meet. He had the time for everyone. He would talk to you. I can't find a most decent man. He was 98 and he had home care. He had cancer, and Jim got rushed to hospital, and because of poor communication, nobody knew that he was in hospital, including his son, for 2 days. And this has driven me to develop an app and solve this problem. There is a massive communication problem in healthcare, in social care, and in particularly adult home care. It's really, really affecting a lot of people, and we've come together this weekend to solve this. The main issues are inconsistent standards of care, missed or late visits, and inadequate systems to report abuse. Our solution is Evercare, an app which allows families and carers to communicate with one another more efficiently than they do currently. So this is our app. It's up and running, it works, it's on our mobile phones. You can log in, it's secure, which is the main important thing when you're dealing with this type of information. It needs to be protected. So the families and the carers log in and they can all see the same thing, because what we're promoting here is transparency in care. At the moment, there's a lot of cover-ups, there's a lot of information that's not being passed on. So families are able to log into this and see at any point, any time of day, when someone last visited their carer, their service user. From the carer's perspective, it helps them become more efficient. So when they first log in, the first thing they see is from the carer's perspective, they see the profile. So I'm talking as a first-time carer, but this is what the families would see too. So from a first-time carer's perspective, you'd log in and you'd see all this information. If you're going into a home, that immediately allows you to make that person feel at ease. It has things such as Dorothy likes a sandwich, Dorothy likes milky tea. That's not stuff that's included in care plans at the moment. Care plans are functional. They're about their assessment of a person in terms of their medical needs. It's not about the person, and this service user page is really important because of that. This is the main feature of our app, and the main bit that is just essential is the people posting. So you have the two parties, the families and the carers, and they're able to post messages. So instead of making paper documents, they can post on here. Because at the moment, can you believe in this day and age, a care plan is not even PDF form, it's on a piece of paper. It's stupid, it's ridiculous. We need this industry needs tech, and it needs more efficient, and we can help. We've got the capabilities here to do it, but no one's helping them. So that's what we've tried to do this weekend. So say Alicia is a carer, she's verified, and she logs on. We're able from this information to track punctuality, track general condition using sentiment analysis, and it has an alert system for abuse. We spent a lot of time this weekend doing market research, and it's a massive market, and we're an ageing population. 5.7 billion spent on care agents to deliver home care in the UK. We also consulted with all stakeholders, families, carers, care agencies and councils. And the council's on our side. They love the idea. They want to implement it if it is proven to have specific results for them, and that's reducing costs. Originally, we wanted to get a care agency to take it on, but care agencies who are subscribed, who the council has a contract with, are not interested. One of the women, they are interested, but I'm really sorry, I'm so nervous, and we've done such a great job this weekend. I'm just trying to get to it. Competition, there is no competition. We have first mover advantage. We have some of these We have a lot of features: secure login, client profiles, a live news feed. Our only similar competitor is Care Monster, but they're in the US and they don't have the values that our organisation has, and they don't have the features either. In terms of tools that do a similar thing, you have project management tools. They could do the same job, but they're not tailored to the care sector or the home care sector. Our business model, we're software as a service. Our customers and our pay point is we are £5 per employee is what we're going to charge to roll it out. Our customers are local council authorities. Our go-to market plan is to start with a care agency, get them to see the benefits of it, and then hopefully we could use that as proof for the council that it works, it's tried and tested, and then it becomes a mandatory thing that care agencies have to have. And it's called Evercare, and I've done a really rubbish job, and I know I have, but it's fantastic, and we're going to make a difference.